Okay, now let's talk about what we look for during a colonoscopy. Okay, what is a colonoscopy? What's the point? A colonoscopy is a colon cancer screening evaluation that we do. We put a camera up your bottom. We look at the entire inner lining of the large intestine, looking for things like polyps, masses, or any other abnormalities. The way we do this is we first advance it to the very beginning of your large intestine, which is where your small intestine meets your large intestine and where your appendix sits. Then we slowly withdraw. The withdraw portion is when we are really looking at every single crevice of the large intestine, looking for the abnormalities. If we find a polyp during that time, we can remove it at the time of the colonoscopy. There's a couple of different instruments that we can put through there, and we can take it out at that time. There are different features of polyps that make us feel like it looks benign or maybe looks more concerning. One of those things is size. Is it a very big polyp, or is it just kind of a small 4, 5, 6, 8 millimeter polyp? Is it flat, or does it have a little stalk on it like a mushroom? Is there ulceration in the polyp? Because you can't really tell what kind of polyp it is, every single polyp, when I do a colonoscopy, gets removed and it gets sent over to the pathologist who looks at it under a microscope so they can tell us exactly what it is. If there's something that looks abnormal, we can also biopsy it at the time of the colonoscopy. And another thing that people find interesting is if it's not something that we can remove, but we are going to need to go back to this area, we can actually put a tattoo on the inside of your large intestine, and that thing sticks around for years, sometimes permanently. The reason that colonoscopy is the desired screening test is because not only can we see the polyps, we can remove the polyps, and early cancers sometimes can get fully removed just from taking out the polyp with a colonoscopy, and you don't need anything further. So not only is it screening, it can be diagnostic. It can be preventive. If we take out a precancerous polyp, we have prevented you from getting cancer, and the early cancers we can often treat. This is the only colorectal cancer screening tool that can do all of those things. The poop in the box is great if that's the only one that you want to do, but it cannot prevent cancer and it cannot treat cancer. So if you are 45 and you have not yet had colorectal cancer screening, ask your primary care doctor, find a gastroenterologist, find a colorectal surgeon who can do that screening for you. If you're in Houston and you need a colonoscopy, call my office. I can usually get you in same day or next day. We can do a telehealth quick summary of your health and get you scheduled within a week.